The hematoma, for those of you who don't know, oftentimes they're secondary to a chronic otitis, and the dog has been shaking the head back and forth because the ear is bothering them. And then what will happen from that impact is that the layers of the ear actually separate. So we get a separation of where the outside of the pinna and the inside of the pinna are. And then certainly in between those is that cartilage that's attached. So when that happens, it's kind of like whopping your thumb with a hammer, is that there's a lot of bleeding. And so when that bleeding happens, then there's a lot of fluid, and then that fluid becomes serum as that blood forms a clot. And optimally is that you can get that drained right away. I have used Vacutainers, and on some of them, if we catch it really quick, and then can put a compression wrap, just doing that alone. I also used to inject a little bit of a long-acting steroid into there to kind of stop that inflammatory reaction. Then that was good. Other times, if you don't catch it soon enough, then there'll be some thickening. It may be surgery then that's recommended because the dog just keeps flapping it. And you certainly can leave them go, and without intervention, they will become a cauliflower ear. So it's smaller and thicker. But by that time, it's really just scar tissue, and it doesn't, I wouldn't look at it like being a chronic active thing. You know, the chronic irritation is down inside. So that falls on to number one is getting that body to not be so alkaline. We'll talk about this in the post course that I'm going to be doing, a 4-week program, that these very alkaline bodies is where the yeast and the bacteria can live. If you can get that pH to between, like, say, 6.4 to a 7, these microbes are not going to be able to live. So when we have this chronic yeast otitis or that chronic bacterial smell where you get that seborrhea and they've got that oiliness, all of that, and the bacteria living there is the part of the problem is that the body's pH is too high. And so we work at getting that down. That would be more of that chronic inflammation that would lead to autoimmune than the hematoma, chronic chronicity, just being a cauliflower ear.
It's important to cut your dog's dew claws regularly as they can easily be overgrown, making your dog prone to more injuries or body pains. Click this next video to find out how to trim these dew claws.